In the first webinar, we completed steps 1 through 3 in the 12-step UFE approach. So we talked about step 1, which was about organizational readiness, which was about how interested are key people in using the UFE approach. We then went on to step 2, which talked about evaluator readiness. How ready is the evaluator to do UFE? How committed is he or she? And what are their skills? Finally, we talked about, in the first webinar, step 3, which was about how to identify primary intended users of the evaluation, or PIU, key people who have a stake in the evaluation and will use it. In this webinar, we will discuss steps 4 through 8 of the UFE checklist. So we will begin with how to do a situational analysis, because we know that all use is context specific. We will then formulate key evaluation questions and validate them, keeping in mind the intended outcomes of the program. Once we are clear about what questions to ask, we will decide what data we need and plan how to collect it. This webinar ends with the 8th step of simulation, which is really unique to UFE. So let's get started. Let's begin with a quick review of the UFE principles. These principles will guide us in the second webinar as well. So the first principle is that UFE does not advocate any particular evaluation, content, model, method, theory, or use. Instead, it's a process for helping primary intended users, or PIUs, to select the most appropriate content, model, methods, theory, and use for their own particular situation. So we see that situational responsiveness guides the interactive process between the evaluator facilitator and the primary intended users. For these reasons, UFE is called a collaborative process, where the evaluator facilitates the judgment and the decision-making by intended users. The focus, in other words, is to support learning. The third principle is about the evaluation process, which is designed to ensure use. Intended users are more likely to use evaluations if they understand and feel ownership of the evaluation process and therefore the findings. And so by involving the intended users at every step, the evaluator is in fact training the users for use and preparing the groundwork for use. In Patton's words, the focus is, quote, how real people in the real world apply evaluation findings and experience the evaluation process, unquote. So UFE recommends that the evaluation plan be part of the initial design of the project so that the use of the findings is planned for right from the start. And finally, the evaluator does not act like an external independent judge, but is actually a facilitator who engages the PIUs at every step of the evaluation, design, and process. So these principles provide us an overview of what UFE is. So let's now move on to the next step, or step 4, of doing a situational analysis. In a situational analysis, the evaluator and the users will consider possible barriers or resistance to use. And so the barriers may involve people who do not believe in evaluations or who have already made up their minds about the worth of the project being evaluated. There may be even some resource constraints in disseminating the findings and promoting use. Evaluations are often political, and understanding how the political context may affect use is critical. For example, one of our projects records health rights violations in government health services. It is possible that the government authorities will not be willing to accept the results. Here, an understanding of the political context becomes very important. The evaluator also explores opportunities that can influence use. This includes identifying factors that may typically facilitate use, such as the usual accountability demands. Decision makers like to know how the monies have been spent and what has been achieved. It's also useful, however, to explore unusual factors that can influence use. For example, one may explore any upcoming decisions or deadlines that the evaluation findings may contribute to or can be used strategically for. We have a project in the Cook Islands that is developing an online database of Maori words to encourage use because the language is on the endangered UNESCO list. In 2015, Cook Islands celebrates its 50th birthday. Perhaps the government, and specifically the Ministry of Culture, may be interested in this Maori database. So the situational analysis will scan such opportunities as well. So in the first group work of this webinar, we suggest that the evaluator recaps and reviews the project and organization readiness, as well as the selection of the users. With the users, the evaluator then moves to facilitate a discussion on the following. What could be the barriers to evaluation use? The evaluator and users will explore both the expected barriers as well as brainstorm on possible and the unexpected barriers. Next, they will explore what are the factors that can support use. This will include an understanding regarding available resources, budget, as well as human, that may be needed for analysis, reporting, and use. It could also include imminent decisions and deadlines that can unexpectedly promote use. Having explored both the barriers and the supporting factors for use, the evaluator and the users will review the representation of users. Has anyone been left out? Should someone be included? How will this representation affect use? Next, the knowledge levels of PIUs regarding evaluation is explored and plans made on how to enhance the knowledge. And lastly, but most important, use. How, when, where is explored. Please make a note of these discussions and consult with a UFE mentor, in this case, with me. The next few slides will help you to develop the key evaluation questions that will guide the evaluation process. The key evaluation questions always reflect the use that is intended by users or by the PIUs. While thinking about possible key evaluation questions, the evaluator helps the users to articulate what do they want to know, why, how will they use the information. This appears to be pretty straightforward, but in practice, the users may have many queries, and it's up to the facilitator evaluator to help the users narrow down what are the most important questions, what findings are they interested in, always reminding them how they intend to use the findings emerging from the key questions. For example, in one project working with the tea garden workers to document health rights violations, the key question that was first developed was the following. To what extent targets are reached in reporting, verification, and follow-up? A discussion on who would use the data and how led to discarding this key question and including two new key evaluation questions. So the new ones were, the first, what are the factors that affect the participation of volunteers who report these violations of health rights? And the second key evaluation question was, how do different stakeholders perceive the changes that the project has brought? The user was the program manager of the local implementation agency, and the aim of this exercise was to strengthen implementation and the use of the application so that the learnings could be used to develop the next phase of the program. So linking the key evaluation questions with the users and the users is very important. So this brings us to group work 2A. Here the evaluator will work with the users to formulate one or two broad headline key questions. Ideally, the key questions should not exceed 4 in number, and for this exercise, we suggest formulating just 1 or 2 key evaluation questions. One way of formulating key evaluation questions is to invite the primary intended user to write on a post-it all the key questions that they are interested in, keeping to the rule, 1 question, 1 post-it. The post-its can then be collated and clustered. Usually, 1 or 2 key evaluation questions will emerge. These should be then written on separate post-its or on a chart paper. Against each of the key questions, ask the users to review. What is the use of this question and how will the user use the findings? As you review, it's possible that you will discard some key evaluation question and add new ones. Remember, key evaluation questions must be sufficiently broad but provide sufficient clarity regarding how the findings will lend themselves to use. In the next slides, we will discuss in detail how to refine the key evaluation question so that we may proceed towards data collection. Review each key evaluation question with the user and consider, what does the key question refer to? Is the key question about inputs and resources? We all know that if inputs and resources are not available in a timely way, the program will get affected. So questions in this category may include, how adequate is the quality of the resource materials? Or you could have questions that relate to the adequacy of staffing, or the type of clients being catered to, or is the needed technology in place and operational? If you have key questions that relate to outcomes and impact against stated objectives, we measure here the success or failure against the project goals or objectives. To what extent can we attribute outcomes to the intervention? And so the key questions here will relate to the change that has happened as a result of the implementation. And the intention here is to judge the value of the intervention and whether to continue or not. Often, questions in this category are aligned with accountability, and funders and decision makers are usually interested in asking these questions. We may be interested in the approach or model being tested. So the key questions will refer to the model and approach. For example, were there deviations from the original model or approach and why? How replicable is the model? What can be generalized? What will be specific? To take an example, we could ask in a program that we had evaluated, how has the child participatory approach to health education worked? Were children involved in planning, implementation, and reviewing the outcomes of the health education program? What worked, what did not? In what context will such a model of child participation work? In a rural context, in certain communities, or certain cultures? Is there a clear connection between inputs, activities, and outcomes? You may want to have key evaluation questions that look at process, which focuses on the actual implementation and tries to understand the strengths and weaknesses. Here we are interested in the how, what's happening? How do different parts of the program fit together? For example, while evaluating a health program, we may want to know, how are the emergency calls being addressed? What is the experience of the community advocates while reporting health rights violations? How do the clients experience the use of the new technology? What is the perspective of doctors regarding the new technology or application? You may also be interested in the quality of the intervention, and so questions would relate to what are the weaknesses or how do you enhance quality? We may be interested in the cost effectiveness. Is this an effective practice, cost efficient, that should be funded? How do outcomes and costs compare with other options? So we see that the analysis of key questions helps the user understand what exactly they wish to know and why, so that the intended use is absolutely clear. This slide is very useful for the users to understand how change takes place. And for any intervention, we have inputs which we believe will lead to a certain set of activities, which in turn will lead to outputs at first and over time result in outcomes. Outcomes being changes in behavior, knowledge, attitude, which over further time and sustained effort are likely to lead to longer-term impact. So here is an illustration of the theory of change or this trajectory of change from the HIV/AIDS sector. In order to reduce new HIV infections, condom use needs to be increased. So, in such a project, we could have inputs which include the recruitment of stockists for condoms, identifying community health workers, and the development of communication materials. Activities could include the training of community health workers, meetings with high-risk behavior groups, and outputs could include the number of condoms distributed or the number of trainings held. And we would expect that these outputs would lead to outcomes such as changes in behavior regarding the use of condoms or increased knowledge of HIV or greater awareness of risk of HIV. And hopefully, this would translate over time to create impact, safe sexual practices, or the reduced incidence of HIV. You can see the arrow on the right, which indicates that the main challenge of any evaluation is to identify and document impact and results of a project or program. While one usually has good control over and can predict project input, activities and outputs, and to some degree outcomes, it's really very difficult to attribute the project's impact because these can be generated by too many factors other than the project itself. For example, the impact in the HIV example could also have been because of a government-sponsored TV media campaign. Evaluators can use this trajectory of change to help users locate the key evaluation questions. For example, in the Cambodia project that was testing an application for TB case detection, they came up with this key question. To what extent has the use of the application impacted case detection? This question was about documenting outcomes for project improvement. It could also have been used for fundraising. It could also be used to compare this approach for case detection with and without the app. So we see we can place key questions at different points in the trajectory of change. So let's talk about how do you make a good key evaluation question. To begin with, check your question. It should not be a closed question that can be answered as a yes or no. At the same time, it should be broad enough to be broken down into smaller questions. For example, a question such as, did community workers use X application software? This is a closed question and the answer is limited to a yes or no. But let's consider a key question such as, to what extent were the community workers able to use the application to identify TB patients? Such a question guides the evaluation and also lends itself to be broken down into many sub-questions such as, how were the community workers trained to use the application? What was the quality of the training? How many TB patients were identified compared to the traditional approach and so on? It's always tempting to include many key questions, but experience tells us that it's a good idea to limit them and to limit them to a maximum of 4. At this point, if you have been able to identify questions and the user has identified too many questions, this is where you can refine the question and to also reduce the number. By now, you may have 2 to 4 key questions. I found this step of linking the key evaluation questions to the project objectives to be extremely useful to limit both the key evaluation question as well as the sub-questions of the key questions. To do so, first list the specific project objectives. These refer to what the project aims to do. place each objective on one post-it and place it on the wall. Now, list the key questions and if you have any sub-questions. And for each of these questions, ask, is it linked to the project objectives? Does it make sense? In our experience, we have found that users and evaluators are able to considerably reduce and refine the questions to a manageable number. And while doing so, it's also common to rephrase and refine the questions. With this, we move to our next group work, 2B, where we continue to work on our key evaluation questions. You've probably realized how important it is to formulate good key evaluation questions. So first begin by reviewing each of the questions written earlier. Clarify, where does it lie in the trajectory of change? Next, use the tips discussed in the earlier slides to refine the questions. And next, validate each of these questions with the project objectives. Now that we are ready with the key evaluation questions, we begin the process of data collection by asking first, what data do we need to answer the key evaluation question? A systematic way to detail this process is to follow this table. So in the first column, state the use of the evaluation. In the next, list your key questions. In the third, identify the data you would need to collect to answer the question. Then, list the data collection methods. In the next two slides, we will detail the different types of data collection methods that are available. In the last column, provide a timeline for collecting the data. So having identified the data to be collected, let's review the menu of methods that are available to collect this data. In deciding which data collection method to use, it's good to remind ourselves that there is no magic key to identify which is the best method. All methods have limitations. So it's a good idea to combine a few methods. Sometimes we choose a method because we have a certain expertise regarding the method or because of some considerations of time and cost. And some questions are aligned to certain ways of collecting data. For example, we may need to collect a large number of quantitative data, in which case a survey method would be more appropriate. Perhaps we want to understand the perspective of a certain target group. So in this case, we may want to use qualitative tools such as interviews or focus group discussions or collect stories of change. And sometimes we choose methods depending on the capacities of the people from whom we need to collect the data. They may not be literate, in which case a questionnaire would be completely inappropriate to use. And if language is a barrier, we may like to use symbols and matrices, which has less emphasis on the written or spoken word. So one has to have many considerations when we think about selecting the data collection methods. Another way to choose a data collection method is to understand where the key question lies in the trajectory of change, and we've discussed that. For example, to study the impact of a program, one may use contribution analysis or impact assessment. If you want to study outcomes related to gender, one can use GEN, which stands for Gender Evaluation Methodology, or you could use the most significant change approach, which collects stories of change, or you could use outcome mapping, which plots behavior change in different partners. If you want to study an approach or a model, one could do a comparative analysis of the strengths and weaknesses of different approaches, such as a comparative analysis of software application versus paper and pencil protocols to detect TB cases in the community. If we want to evaluate the implementation process, we could use interview processes or focus groups. To study quality, we can audit the current services using standardized quality control checklists, or we could ask experts to review the services. If we want to study cost effectiveness, we can take the support of different economic models that can calculate how efficient the project is in the use of its resources. As always, the choice of the method used to collect data is always framed against the uses of the evaluation. So we ask, will the results from the methods chosen be accurate, consistent, true, cost-effective, practical, and ethical? We may want to use population surveys, but these may not be cost-effective or practical. We may want to collect data regarding violence against women, but we must ask how ethical it is to do so. We may want to conduct a large number of focus group discussions, but we must ask whether the data obtained from different sample groups and collected by a large number of data collectors, how reliable and credible is it? So when we ask these questions, we will be able to narrow our choice of data collection methods and select those that are most appropriate for our use. So in group work 3, we plan for data collection. We ask, how will you collect and analyze the data? We may collect a lot of data, but don't have the expertise to analyze it. So qualitative data requires a certain type of expertise to analyze trends, and quantitative data also requires a different type of analysis. So it's good to consider analysis while planning for data collection. The PIUs should be involved in the decision-making process so that they are aware not only what data will be collected, but how it's going to be done. The PIU is concerned about the use of the evaluation findings and may tell you that they need a certain type of data to promote use. And that's why it's important that PIUs should be involved while making decisions about who will do the data collection, how you will sample, and what will be the analysis. So now let's move on to the next UFE step called simulation. Simulation is really unique to UFE. In this step, the evaluator guides the PIU to review possible, and I reiterate, possible, positive and negative findings. The findings are all fabricated and dummy. That means fake tables are prepared. The point of simulation is to find out whether the key evaluation questions result in findings that are usable. The UFE step of simulation comes after many deliberations of defining the key evaluation questions, selecting the best evaluation methods. So one is really tempted to move quickly into piloting the data collection tools and getting on with the evaluation. And it may really feel that this step of simulation is placing a brake on the whole evaluation process. But in fact, simulation provides a chance to review the key questions. And in our experience, it's been very useful to refocus the key evaluation questions and in some cases add or omit some of them. So here the evaluator can prepare these dummy or fake findings and tables and then dialogue with the PIU asking, if you got such results, will it help you to use the findings? If not, what should we modify in our questions? Or regarding the data that we need to collect? So, to summarize, in this webinar, we've discussed UFE Steps 4 and 5. We discussed how to do a situational analysis and the importance of identifying barriers and supportive factors that will influence use. The analysis also included an assessment of the PIU's knowledge regarding evaluation and planning how to increase it. In step 5, we reviewed the different uses of evaluation. Was it to assess impact so that major decisions could be made? Was it to understand process so that programs could be improved? Was it to understand different approaches and to generate knowledge? Was it to improve quality? We also discussed that it was important to understand the trajectory or the theory of change that underpinned the project that we were evaluating, and to determine whether the key question was addressing inputs, activities, outputs, outcomes, or impact. We also discussed step 6 in the UFE checklist, which was about focusing the evaluation. We discussed how to develop, review, and refine the key questions, always linking them to use. Step 7 talked about designing the evaluation, and we discussed a menu of methods. We said it was important to select the method depending on the key evaluation question and the data needed for use. The evaluator supports the users in the appropriate selection of the methods, keeping in mind the resources and expertise available for data collection and analysis. And the mentor supports the evaluator in the selection of these methods as well. Lastly, we discussed step 8 or simulation, which referred to the creation of dummy or fake data. And so by reviewing such data, the PIU asked what they could do if such data emerged from the data collection. Would it be sufficient for them to use the findings, or is additional data needed? Using simulation always helps to define the key questions. So here is a list of the follow-up tasks for this webinar. This is a summary of the group work and must be completed in this sequence. So, groups should do a situational analysis, followed by the development of the key evaluation question. They should then proceed to plan for data collection and complete the simulation exercise. The Desi2 mentor, in this case myself, will support the evaluation facilitator through Skype and email to complete the UFE steps 4 through 8. So before we conclude, you're welcome to review some of the references that will provide further information. So here are some references for further reading. And here is some useful information to follow up on. Thank you very much for listening in. Until we meet, thank you, everyone.